Edgar Campos from Mexicali Bariatric Center. Thank you for watching us today. One of the questions that we get very often is about the boogie size or about the number of the boogie size. First, what's the number? So boogie size comes into French number. French because the diameter of a tube refers as a French diameter. So it's what we use on any hollow tube that we can use on the medical field. And we have different sizes. Everyone talk about the size of a boogie, and we have basically a calibrating tube. A calibrating tube, it's a silicone tube or a plastic tube that we can put through the mouth and then transfer to the stomach and use to calibrate on the surgery any kind of tissue. We have different sizes, but the most important thing that we want to talk about today is what's the equivalent for a French number. So you'll be amazed that the French number is not that huge as we can tell. Every three French number, it's 1 millimeter in diameter. And to give you an idea about the size of a millimeter, it's about the size of the tip of a pen. That's 1 millimeter. So every millimeter, it's 3 French sizes. That means that the boogie, about 30 French, it's 10 millimeters or 1 centimeter. So it's not that big. So every increase on the boogie size is not a huge increase on the real size. Even though the number is bigger, the real size is not that big. So it's quite important. More important, it's how do we use the boogie to do the surgery than just the number that we're using. Here at Mexicali Bariatric Center, we have normally 36 boogie to calibrate the gastric sleeve, or we have a 36 to calibrate the gastric bypass and anastomosis. And it's very important because every time that we're using a boogie, we know that we're stapling it and leaving a very small stomach. There's one big risk if we use a very small boogie and we use it properly, and the risk is that we have a very small stomach and we have an stenosis. So what we advise is we use always the same boogie line or the same boogie size, and it's a 36 French boogie. So the 36 French boogie is something like this. So we can tell that the 36, it's around a little bit bigger than the size of a pen. This is a 32, which is not that big. And then we have a 38. And then we have the 60, which is a very big boogie. So normally we're using a 36 boogie. So the boogie is a hollow tube. That means that we have some space in the middle, and we can pass the boogie through the stomach. We can aspirate all the fluids or the air that is inside the stomach, and that helps us. So your stomach will be empty at the time that we're stapling, and that gives us more comfort to squeeze the tissue with the staplers. And that gives us a real size so we can move the stomach down. We don't have a big balloon of a stomach. So this is the boogie that we normally use. This is a 36 boogie. So the next step is how do you use a boogie? Because the boogie goes as a tutor inside the tissue. So picture this is your stomach. So the boogie goes in here. When we use the staple line, we know that we're stapling right on the side of the boogie line. So this is very important. So what we do, it's basically we use a cartridge which contains all the staples, and then we put the boogie, and then we pass the stapler, and we know that we're stapling on the side of the boogie line. This is very important because you can have a 28 boogie, but if you staple 5 or 10 centimeters on the side of the boogie line, it's basically you're using an 80 boogie. So what we use is a 36, but we do it very, very close. So we know that we're squeezing the tissue and we're stapling. Once we squeeze all the tissue, and there's no air, there's no bubbles, and all the water from the tissue goes away, we can begin firing the staple, and then it cuts and removes the tissue. Then the next step is, if you can move the bougie freely through the stomach, it's basically is not the risk of having a stenosis or a stricture. And what we do, it's we over suture the staple line just from the top to the bottom, and it's very important to over suture the staple line because you can protect all the staples. You can just flap the staples with the same stomach, but stapling the over suturing the staple line, it gives us a little bit more tightness on the long run, so it makes the stomach a little bit more squeezable. So we know that we have the same size of a stomach. So picture a 36 bougie and picture your stomach. If your stomach is on the proper 36 bougie, it's going to be a little bit smaller than the regular thumb. And that will be from the bottom to the top. You'll have a very small stomach all the way around. So it's very important to use a bougie, but it's very important to use a bougie properly and then have the normal size properly. Thank you for watching us. I'm Dr. Campos from Mexicali Bariatric Center. If you have any topic or any question that you want to address or any new topic that you want to talk about, just let us know and then we can do a video about it.